the cloud so we can edit this beginning part out. And okay, so Facebook's loading up right now. All right, it's noon and broadcast. There we go. All right, we should be all ready.
Thank you for joining us here today for this important and timely discussion. We will be recording this session. My name is Sue Dinsdale. I'm the director of Iowa Citizen Action Network, and we'll be joined by Jennifer Scherer, Robin Bennett Clark of the Iowa Labor Center, small business owner and advocate, Rashonda Young, and Iowa Federation of Labor President Charlie Wishman. Paid leave is a very important topic right now. That was reinforced to me when I asked organizations if they would be willing to co-sponsor this event. And within a couple of days, had nearly 20 responses. So I'd like to really thank all of our co-sponsors, including Americans for Democratic Action Iowa, the Center for Worker Justice of Eastern Iowa, Interfaith Alliance of Iowa, Iowa Alliance for Retired Americans, the Iowa Coalition Against Domestic Violence, Iowa Federation of Labor, AFL-CIO, the Iowa Main Street Alliance, Iowa State Education Association, LULAC Iowa, the National Association of Social Workers, Iowa Chapter, Paid Leave for All Iowa, Planned Parenthood Advocates of Iowa, Progress Iowa, the South Central Federation of Labor, AFL-CIO, Tax March Iowa, Teamsters Local 238, United Steelworkers Local 105, and Women in the NAACP. As you can see, we have a broad range of organizations joining with us today. You know, Iowans are facing impossible choices, being forced to choose between job and family without risking their job or paycheck. If COVID-19 has taught us anything, it's that paid leave goes beyond helping families and saving lives. It bolsters the economy by helping employers retain their workers and stay afloat while doing so. It has shown us that paid leave needs to extend to all employers, that those with over 500 employees must be included so that every worker can receive this benefit and it's not just left to the discretion of the big companies. In March of this year, due to the COVID-19 pandemic, Congress passed historic legislation, the Families First Coronavirus Response Act and the Coronavirus Aid, Relief, and Economic Security Act, or CARES. This allowed many workers in the United States access to paid leave and paid family care leave for the first time. But because the temporary COVID-19 response packages included large exemptions at the last minute, millions of Americans still have no access to any paid leave or programs that enable them to take time to care for their families without risking their jobs or financial security. And while there has been growing consensus on the value of a paid family and medical leave policy, lawmakers continue to differ on who it should cover and how it should be funded. Paid leave works. We've known it for years, and this pandemic has brought it to the forefront of our discussions about essential workers and economic recovery. Paid leave legislation has been introduced at the federal level and here in Iowa for decades, but it has failed to become law. So while we're all ready for 2020 to end, the future is uncertain. Paid family leave is set to expire on New Year's Eve, leaving thousands of workers to make impossible decisions for themselves and their families. It's obvious that the effects of this pandemic will be felt for years to come. especially in the labor market. Office work will most likely never be the same as it has been, as more companies veer towards working from home. But for 6 in 10 Americans, that's not an option. Without increased benefits for these essential workers, like a living wage and paid leave, they'll have to continue to choose between their safety and a paycheck. Working parents nationwide are struggling to maintain some semblance of balance during this pandemic. For this, we need paid leave. This is not just a women's issue. Surveys show that men feel supported and satisfied providing care and believe it is the right thing to do. Yet they face economic hurdles when it comes to being able to take time off to work to provide care. It also means recognizing the impact on the health of the entire community. When sick people go to work or their children go to school or daycare because their parents can't afford to stay home, it affects all of us. I'm going to pass this over to our partners at the University of Iowa Labor Center for their presentation on paid leave, pandemic, and beyond.
Thanks, Sue, and hello, everybody. I am Jen Shear. I'm the director of the Labor Center at University of Iowa. I'm really delighted to have been asked to participate in this event. This is an issue that we talk with workers about regularly in our work and have for many years. Our mission at the Labor Center is to provide education and research on labor and workplace issues, and leave is a really, really important part of that nexus. We also know that, as Sue reminded us, the COVID crisis has magnified just how vital paid leave is and how unprepared our state and nation were in many ways when the pandemic hit this year. We know workers and employers across the state have been stuck between a rock and a hard place, choosing on a daily basis often between their jobs and their income and their health, or the ability to stay open and keep operating, and the risk that it poses to business owners, employees, and the public. So one of the things we're going to try to do with the time we have today is focus on and draw on real life Iowa stories. And I'll say that at the Labor Center because one of our functions is to provide information and education on workers' rights, that we're in contact with workers from a very broad range of occupations and workplaces. And I'm just pulling out one of, what could really be thousands of different instances of the kinds of dilemmas people are facing. This is a person, saying, yesterday I learned that the person who works next to me tested positive for COVID-19, called my doctor who told me I should quarantine for 14 days. And in fact, my doctor said I should really try to stay out of work longer than that and avoid additional exposure because of my age and an underlying health condition. I cannot afford to miss 2 weeks of work without pay. What should I do? This question of what should I do is a heartbreaking one that I've certainly been hearing much too often this year. We also know this is a question that's not new. We were hearing this question from people before COVID-19 existed, people who needed to seek cancer treatments and were at risk of losing their job, people who had a child with an accident and didn't have the ability to be there with them, people who were facing the dilemma and the question of how soon must I return to work after giving birth if I don't want to risk losing my job. We also know that the United States is way out of step. We were out of step before the pandemic, and the call for paid leave and a comprehensive structural approach to covering everybody in our country is literally generations old, literally hundreds of years old. There are many, many ways to measure this and compare us to the rest of the world. I'm just pulling out one of many. This is a chart that measures paid sick days that are available to cover people with a serious illness and also with a short-term illness like the flu. That's what the light blue bars are. And what you see is that the US is always down there with the zero, the zero when we stack up with. We do not provide on a federal, comprehensive nationwide level any minimum standard of access to leave. What we do have in place are a couple of very, very important laws, but laws with very serious limitations that are now a couple generations old, from the early 1990s. The Family and Medical Leave Act, a big breakthrough in our legislative history, but it offers some unpaid leave. for some covered employers, not all, for some eligible workers, only if you're in a firm with 50 or more employees, and only for some conditions. And once you get through all those hoops of exclusions, we're leaving a lot of people out, even of the unpaid leave protections. And we still are the big zero in the across the globe internationally in terms of offering paid leave. So this is really where we are on the list. Not only do most countries around the world guarantee some minimum amount of paid leave across all industries, across all workers, so we don't have these disparities, but most countries address the real life needs of businesses and human beings. Everyone at some point in our lives as a human being needs to be away from work in order to take care of themselves or their family. Most countries address this need and reality with policies that include several types of paid leave, not just one. And we're a big zero on all of these, except for the unpaid leave for a serious health condition or caring for a family member's serious health condition. And I think the easiest comparison sometimes to make is our direct immediate neighbor to the north. We don't have to look too far away to think about what is in most countries around the globe very different. We also know that this means that global corporations, North American corporations that often operate in multiple locations are successful and profitable and know how to operate successfully by following these policies. When all employers in a country have to follow the same policy, it levels the playing field across the board and creates a different level of support for public health and worker health, decreasing turnover costs, some of the other outcomes that researchers have found that Sue mentioned earlier. So in our country, where are we? What is our starting point? And particularly in Iowa, what's the landscape we're facing? Who does or doesn't have paid leave in Iowa? Well, it's really a toss-up. Depends on who you are, depends on where you work. We know that we've got the Family and Medical Leave Act as the baseline for some workplaces, but not all. And in some cases, workers are covered by a union contract that often has some provisions for paid sick leave or other kinds of paid leave. And then some cases, people work for an employer that has adopted a policy at the corporate level or at the local workplace level. But there's no consistency or standard or floor that everyone has to follow until this year. So this is the first time ever the COVID context created in some ways the crisis that led Congress to adopt the first federal paid leave law in our nation's history. But as Sue mentioned, it's temporary and it is on the verge of disappearing at the end of December. This was the Families First Coronavirus Response Act. And she also mentioned and reminded us already that even this emergency provision, which was necessitated by our public health crisis, does not cover everybody. Employers with 500 or more employees were not covered, and that cut out millions and millions of people from coverage. Now, on the other hand, this was an interesting and important experiment that our country undertook for the first time of implementing a program that provided 2 weeks of paid sick leave for people who were covered with a tax credit available to employers. So it did not come out of employers' profits and enabled them to keep up and running while allowing their employees to stay healthy and while allowing them to follow the public health guidelines of making sure sick people weren't at work and exposed people could quarantine. I'm also going to put in the chat a link to a longer fact sheet for those who are interested in more information about that new law and some of the details and who's eligible and how folks can follow it. Because we do still have a few weeks of that law in effect. And I know there's lots and lots of discussion and debate continuing about whether it will be extended or could be extended in some fashion. We've heard throughout the pandemic calls from public health experts, calls from economists, calls from international groups like the Organization for Economic Cooperation and Development, which is the statement that I put up here, about the importance of implementing paid leave and paid sick leave in particular in order to move beyond the COVID crisis and to sustain our economies through the COVID crisis. Since the US is the only advanced country without a federal mandate for paid leave, we have been hit particularly hard, and both our business communities and workers on the front lines have struggled enormously with the dilemmas and the stress and the health effects, and frankly, the preventable deaths that have resulted from our lack of any kind of standard. So I'm going to turn it over to a couple more Iowa stories at this point. Back to Sue, who is going to introduce us to one of our guests.
Thank you. Our first guest during the webinar is Rashonda Young. And Rashonda and I have worked together with the Main Street Alliance here in Iowa, and also through Iowa Citizen Action Network for a lot of years now. And Rashonda, I know that you personally work with a lot of small business owners, and we hear about small business owners don't want a paid leave program, or they think they can't afford one. What are you finding to be the case?
Small business owners really do want a paid leave program. Oftentimes, they're working in their business, so there's really no safeguards if they get sick. But then also they're employing people who are like family to them, and they want to be able to provide for them if they become ill. The problem ends up being that many of the businesses that I work with, they're small or even micro businesses, and they simply do not have the capital. Most of them are minority-owned businesses, and I'd say probably 60 to 70% are female-owned. And even before COVID, there was such a lack of access to capital, underfunding of the business. So with COVID coming into play, it's really exacerbated the problem. And so do small businesses want a paid leave policy? Absolutely, they do. At least the ones I know do.
Yeah, and that's what I say. COVID is kind of put everything on steroids when it comes to what's happening with our business owners. And so obviously you think the government's pandemic response around paid leave has helped to keep these businesses afloat and had other effects. What do you think is going to happen if they don't continue this? I mean,
so many small businesses are like just on that teeter of, am I going to make it? Am I not? And all it takes is, one or two illnesses. Or Sue, you and I were talking about the one small business owner that I'm working with who has two businesses that were initially shut down as a result of COVID. And then she was only able to get a very small amount, like $6,000 for PPP protection for two businesses that were shut down. And so coming out of, COVID and we're still in COVID, but being able to actually open back up, she was so far behind because $6,000, that covers one business for 1 month. And so then she and her family who run the businesses all got sick with COVID. And so then the businesses are shut down again. And you're just at a point then where you were undercapitalized, you did not get the PPP protection that you really needed, and then your family gets sick. Honestly, it's a wonder that they're still able to open their doors today. And I'm telling you, it's a struggle. So
sure,
you take away these protections, and I'm not sure what's going to happen.
We talked a little bit about all of the business owners that you work with and how your responsibilities have increased exponentially over the last few months. And maybe you'd just like to touch on that and about, that business owners aren't policy experts.
Yeah, exactly. So the business owners are busy trying to run their business. They, like you say, Sue, they're not policy experts at all, and they're not expected to be. So even having the paid leave assurances that they had because of COVID, I can't tell you one of them who knew about that.
Right.
You know, they didn't know. And so, yes, over the past 6, 8 months, I've been so much busier than I had been simply because people are trying to figure out, where do I go from here? How do I keep my business going? And then, also just needing help navigating the PPP or the EIDL, all these things that they're needing assistance with. So yeah, I've been a lot busier just because people are trying to figure it out.
Well, thank you so much for being with us today, Rashonda, and thank you for all the work you're doing. I know you're probably single-handedly helping a lot of businesses in the Black Hawk County area navigate
I'm
these
trying.
treacherous times. So thank
Yeah,
you.
I'm trying. Thank you.
Thank you so much for sharing your firsthand experience. And as Rashonda reminded us, business owners are not policy experts. Most workers are not policy experts. And the reality of lacking a consistent standard or a baseline policy for all of us to follow is that we live within a world with a patchwork of policies that vary extremely widely across one workplace to another, and sometimes within an individual workplace. There are a long list of policies that might or might not be included to cover circumstances related to leave and absences for very, very important circumstances like childbirth, illness, and caring for a family member. So some workplaces might offer paid sick leave, some might offer disability benefits, and some might not. And I will say one outcome of this is simply lots and lots of confusion and the education and information gap. On the one hand, it might be, it might sound like job security for folks like me who can spend lots and lots of time answering people's complicated questions, but it's not a pragmatic or practical way to run our society and to run our, certainly not to protect our public health in a time of a pandemic. Just to pull out one of the types of policies on that list and also give people a snapshot of how likely is it, for example, that an employee in the US will be able to access paid parental leave depending on where they work. The size of your employer might affect whether or not they offer that benefit. But even if you work for one of the largest companies in the country, you are still less than 40% likely to be able to access parental leave in the US because we don't have a policy that requires it. And so the vast majority of workers don't have access to that kind of paid leave today. And we don't have that in Iowa because we don't have a state policy. We also know that this absence of a national standard of a paid leave threshold or floor fuels some of the existing inequalities in our economic system. The gap between higher income and lower income workers gets exacerbated by the inability to have paid leave benefits and the inability to hang on to your job if one illness or one family accident occurs. So depending on your occupation, folks who are in professional white collar management level classifications are far more likely to have access to paid leave. Whereas folks in construction or service industry, restaurant, hotel, hospitality, sales, low wage occupations are also far less likely to have access to those benefits as part of their employer's policies. And we also know that in Iowa, in most hourly jobs, the policy is you can't miss work at all for any reason without potentially some kind of penalty applying to you. And just to give people a quick glimpse of what kind of attendance policies are fairly typical in manufacturing and service sector hourly jobs in a state like Iowa. If you miss a day, a point is assigned to you, and those points add up. And after a certain number, you're going to be disciplined and you may lose your job after a few of those points add up. And that means, it doesn't matter if you're missing work because your car broke down or because you have a serious illness and are completely incapacitated, or you're going to the hospital to get your cancer treatment. These points apply regardless, and there is no provision for paid leave in most workplaces. So that's the landscape, or the policy landscape on the employment level that we went into this pandemic with. What part of the public health response and the occupational safety response to the pandemic has been some very, very important and sound guidance that's come from our federal agencies, from the CDC and OSHA, which are reminding us and telling us that the way you deal with a public health crisis is to do things like, and I pulled this right out of their federal guidance on what employers should do in order to combat the spread of the virus. We need to actively encourage sick employees to stay home. We have to make sure we're not requiring people to go to a doctor and further spread the virus just to provide a note for their employer. We have to ensure that sick leave policies are allowing people to stay home to care for a sick family member, because that's necessary right now. And we have to make sure that employees are all aware of the policies and that employers are getting the information they need about changes in those federal laws. So there's a direct conflict and a real tension between what our federal agencies are saying we need to do and, on the other hand, the absence of a policy that allows and ensures that employers across the board can actually do these things, and that workers will actually have access to the leave they need to protect themselves. So I'm going to stop this again and turn it back to Sue to introduce our second guest with some examples of how this policy dilemma has been experienced by workers on the ground in Iowa.
Well, we're always excited to be joined by Charlie Wishman, the president of the Iowa Federation of Labor, AFL-CIO. Charlie and I worked together for a number of years, and it's always good to see you again, Charlie, even if it is on the small screen here. Maybe you could start out just by telling us a little bit about who makes up the Iowa Federation of Labor and the kinds of workers you represent.
Sure, absolutely. So yeah, it's great to see you on here as well, Sue, as well as Rashonda and Jen. So the Iowa Federation of Labor, AFL-CIO, we are a coalition of labor unions. Is probably the easiest way to explain it. And we represent all kinds of workers, from federal, public, state, local, county, school, building trades, manufacturing. I mean, you name it. If it's unionized, I mean, postal workers, I could go on and on and on and on. So many different professions. And most of them have been deemed essential workers during this entire pandemic. So most of them have continued to be, most of them have been working throughout March, despite everything that's going on.
And I know that you've been hearing a lot from your members about what their experiences are during this COVID-19 pandemic. And would you mind sharing a little bit about what you're hearing from the actual workers?
Yeah, so back in March, when this all started, we made a decision that we wanted to actually get as much input as we could from all workers out there. Because while, like I said, we're a coalition of labor unions, we have an interest in fairness and dignity at work for all workers. And so we, and a lot of these responses are from earlier in the pandemic, but I don't think that paid leave policies have changed since a great deal since the beginning of this pandemic. So here's just a sampling of some of the answers we got. And we got a whole range on many, many different topics, but here's a couple of examples. I have friends that work at a hospital. They have an immune compromised kid. They've been told they can't wear PPE at work, and if they take off 14 days to quarantine to protect their child, their job isn't guaranteed when they return. This isn't right. My employer encouraged a sick coworker to report for work. Even while showing some symptoms, they do not have as much concern about the virus as they do about the appearance of carrying. They were not proactive and have no additional disinfectants. I don't qualify for sick leave pay because I just started to work for the company just for 3 weeks. I work in disaster planning and mitigation, and my wife is an ER nurse. Stress levels are through the roof, and we worry about who we are in contact with, our kids being home, and if we both get sick, what will we do? Here's another one, a confirmed case of COVID-19 in my building, and I worry because our employer didn't have us stop having large meetings until the week when they went out sick. A team still has large meetings, and I worry not enough has been done to prevent the spread. Paid leave is here's one that paid leave is offered if our job is closed, but we are a franchise hotel. It costs too much in penalty fees, so we have to remain open, checking in guests, cleaning rooms, while the owners and upper management continue to work from home. And there's just story after story after story that we collected, and this is just a sampling of them that I pulled out for this webinar, where it just shows why, especially in a state like this, in Iowa, where we have no policies from our government, state or local or even federal, that we don't really have any meaningful paid leave policies, why this virus continues to rage out of control.
Yeah, I know. We've been hearing from a lot of folks too, and honestly, it's gut wrenching, and I'm sure, like you, it keeps me up at night just thinking about all of these workers who are being forced to work. A policy. If our government would just respond, we would be in such better shape. So I guess finally, I know that paid leave legislation is a priority for labor unions. Maybe you could just expand on that a little bit and tell us.
Well,
why.
yeah, absolutely. First of all, let me just say, this isn't a new topic for labor unions, and it's not a new topic for our allies either. Representative Marty Anderson is an example of somebody who has consistently been a champion for this issue. There's been numerous legislators who have stepped up, and unfortunately, these bills don't seem to be moving through the current majority's priority list. But this isn't anything new. I mean, we in the world of people who care about workers have always thought that paid leave makes sense. It just, now we're dealing with a deadly disease that is killed. I don't even know what the count is at the moment. It's yesterday we lost more people than we lost on 9/11. But it's always but beyond just the human toll, we think it makes workers more productive. We think it increases morale. There's so many reasons why paid leave makes sense, not just from the worker standpoint where we're coming from, but from the business owner standpoint as well, I think. And I think Rashonda laid out earlier a lot of good examples of why it makes sense. So, I mean, this isn't a new issue for a lot of us, but just like so many things in the past, 9-10 months, it's thrust these things into the spotlight as to how this patchwork of labor law, especially around things like paid leave. I think you've seen this happen in a lot of meat packing plants, and we have huge outbreaks. I think you've seen just non-consistent even leave policies have been just really, really detrimental. And when it comes down to it, whether there's a pandemic going on or not, Sue, worker health and safety is community health and safety. So if you're not, if you don't feel good, you should be able to stay home.
Yep.
Bottom line.
Exactly right. And the, the cost of a paid leave program, people talk about that, and how, you know, we hear people don't want to have their taxes raised, but the point is, studies show they do. People wouldn't mind paying a little bit in each paycheck in order to have a national plan that would work. So thank you so much, Charlie. We appreciate you being on here, and we'll turn it back over to Jen.
Thank you for sharing those examples. And I want to take both the comments and questions that are coming in the chat and the set of Iowa examples that we've been hearing already so far, and turn the corner here and give us a chance to collectively think about and raise some answers or some hypothetical answers, at least at this stage, to what next, right? The scale of the problem and the urgency of the need for an intervention is very clear. And proposals to create various forms of paid leave on the federal level have been introduced in Congress repeatedly for more than 20 years, and in our own state legislature repeatedly. And I know we've had a little bit of back and forth in the chat already about the anticipation that that will happen again this year. We also know that proposals to allow all workers to earn paid sick leave are hugely popular with the public, as are proposals to create jointly funded programs that cover paid family and medical leave. There are sort of two general types. And these poll incredibly favorably across the country. These are pre-pandemic polls from, in one case, 2016, in one case, 2018. One is from the Pew Research Center, a very well-known national research group. And the other is from the Cato Institute, a very a self-described conservative entity tracking this issue. And in almost every case, vast majorities of Americans say that they want to see paid family and medical leave made available across the board to everybody. Many polls have begun asking people about this question of cost additionally. And that's what we see in the poll on the right, that even if asked about the cost that would be incurred, majorities still say, yes, this is an important policy, as long as it doesn't cost quite too much, right? And in Iowa, we've got a little bit of data just from this past year. In March, when Congress was considering how to implement the paid leave, temporary paid leave protections that got put in place, polling, and this is pulled out just from the Iowa subsection of this poll. So this is a poll in March of over 1,000 Iowa voters. And they again ask the question, not just do you support paid sick leave for workers during the COVID crisis, do you support it even if it means that it would cost something, a few $100s a year? And the support is overwhelming. There are very few things that we can get, you know, across partisan lines, large majorities of people in the public saying, yes, this is important and we've got to do it. So what's going to happen when the emergency paid leave potentially expires? In some parts of the country, not much will happen because there's a state program in place that is already sort of filling those gaps. In Iowa, of course, we don't have any state paid leave programs on the books. And so if the federal program expires at the end of December, people really are back to the drawing board and on their own in Iowa with no access to paid leave unless they're in the small minority subset of employers that do have something in place. And I'm going to turn it back to Sue for one more Iowa story here related to this question of what's going to happen if this existing temporary provision expires, and how are Iowa businesses and workers experiencing that?
Well, just as an example, we've been talking about paid leave at Iowa Citizen Action Network for years. And in the beginning, when we would talk to small business owners, they didn't understand what we were talking about. You know, they didn't think we needed another big government program. But as we educated people, they began to realize what an important thing this would be at a national level. And if not at a national level, at a state level. And, you know, even I think one of our Q&As was that our governor will not allow even local level paid leave programs in our state. So education has always been key. And it was interesting, back in, I think it was September, I was talking to one of our business owners who has a daycare. And she was telling me that they were going to most likely have to close their doors. They were doing the right thing. They were paying their employees who had to take time off for whatever reason due to COVID. And then they were paying the replacement workers, but their revenue was not matching up with what they were putting out in salaries. And she was, I mean, it was literally a tearful discussion about this daycare that's been open for decades that was going to have to close its doors. And I said, well, you do know that you are eligible for reimbursement for paid leave through tax credits. And you could just literally see the relief that came over her. And I sent her some information on it. And I mean, it's saving their business. And of course, childcare centers are so important right now. And the thought of having to lose one because they're doing the right thing is, I mean, it was a great experience for me. It was, you don't get a lot of bright spots right now in these times, but that was certainly one. And, you know, I applaud our federal government for coming forward with a plan. It wasn't perfect, but it did help lots and lots of workers. And they have just got to extend this because this same owner is going to face these same issues come January 1.
Yeah, thanks for that example. And Sue, it reminds me that I had a very similar discussion with a childcare provider, I think back in April, who was so relieved to discover that provision was in place. But it also, you know, reminds us of the heartbreaking reality that there are hundreds and hundreds of others who may not know that there has not been an effective nationwide campaign to even let people know that those benefits are available for small businesses. So I think it's a good time for us to ask, what have we learned and what are we learning from this temporary experiment of at least having some emergency 2-week paid leave that covered some people? And also, what are we learning from the experiments that have been unfolding for almost 20 years now in various parts of the country? And at this point, every region of the country. We've got states with a solid track record of running effective paid sick leave and/or paid family and medical leave programs solvently, efficiently, and in many cases, those that are the most longstanding have already been expanded because they are so popular, both with employers and employees. And the momentum of major cities and other states passing new policies has really picked up, particularly in the last 5 to 6 years. And I'll say, I show this slide with a warning that there are so many of these coming on the books that it's very difficult to capture them all. So this is a snapshot of just some of the cities and states that are passing paid sick leave or paid family and medical leave provisions that cover maybe not 100%, but large majorities or large swaths of all workplaces in their jurisdictions. And to map it out a little bit, this map is interesting because it also includes states like Iowa, which are coded red here because they're places where Legislation has been introduced on the state level. This is just for paid family and medical leave, not sick leave. But it has not passed yet. And so I think it's also an interesting glimpse of how widespread the interest and the momentum for creating broader coverage. If we're not getting it yet at the federal level, states and cities are stepping in to take action because they know that their residents and their voters and their local constituents want that and are calling for it repeatedly. I want to pause for a second and give people also a glimpse of something I think we can learn a lot from, which is when states adopt these policies, how do they work, right? It's we don't have to start from scratch or reinvent the wheel or just imagine how this could work. People are already doing it. And I'm pulling out what's a fairly recent example, since we're in a state, Iowa, among many, that doesn't yet have these laws in place. And I'm pulling out Colorado, where interestingly, just within the last year, they both passed legislation at the state level, ensuring paid sick leave for the first time statewide. That was passed by their state lawmakers. And because the state legislature had tried and not been able to pass paid family medical leave, there was a coalition of groups that moved to put that on the ballot in this November's election as a ballot initiative. Of course, that's a legal option we don't have in Iowa. But I think it's interesting that these two pieces of legislation have been adopted just within a short time within one state, one by state legislators, one by the voters themselves, and that ballot measure passed by I think it was a 57% majority statewide, so a very strong, healthy majority voted for it. And just want to give people a little glimpse of when these policies, they were modeled on what other states have already done successfully. So in the case of paid sick leave, these systems often work as an earn into the system as you go for employees. So it's not that paid leave just falls out of the sky. Workers put in a certain amount of time with their employer, and then they're eligible to earn up to a certain number of paid sick hours per year. In Colorado's case, they capped that at a total of 48 hours per year. So it's not a lot of time. It's in fact not as much even as in the temporary emergency federal COVID legislation, but it does provide something, right? It provides a few days worth of paid leave for unexpected illness, caring for an ill family member. Sick time or safe time, as it's often referred to, is often included in these policies for people who are in a circumstance where they have to protect themselves or move or relocate due to domestic abuse or assault. And that's another reason we do not want people to have to jeopardize their job or their employment if they're in that situation. The other thing about these policies is often that legislators think very, very carefully about phasing them in over time. So in Colorado, the phase-in is fairly slow. 2021, they passed this law in the summer of 2020. They're waiting 6 months to start covering employers that have more than 16 employees. And then they're waiting another year to phase in the smaller businesses that have fewer than 16 employees. So this is very similar to what's already in place in 12 other states on the sick leave side of things. Colorado also now is implementing paid family and medical leave, and that operates a little bit differently. And this is what some people often view as building on and expanding what we've had in place for more than a couple decades in the Family and Medical Leave Act, which is unpaid leave for serious health conditions, caring for family members with serious health conditions, and parental leave. So in the case of birth, adoption, or foster care, that time to care for and be with a new child coming into your home. So this is funded by matching contributions from employers and employees. And in the case of Colorado, they're starting off with a 0.45. So 0.45% of an employee's wages would be paid in, half the 0.45 from the employee and 0.45 from the employer. It's a 50-50 split. And they will build that fund up over a year. So again, this is a slow phase in. They're not going to start collecting the payroll contributions until 2023. They will do that for a year. And then that fund will exist for eligible employees to draw up wage replacement And there's also going to be a certification system, right? So people will be able to draw this wage replacement down as long as they show, just like people have to show for FMLA leave, that they have a serious health condition, or they have to care for a family member, or they have a new child or a childbirth or an adopted child coming into their home. And that won't be available until 2024. So it's slow, but it's going to be a game changer to have both of these policies on the books in one state. I think for states like Iowa and others who are considering options and directions and where do we go next, but another critical question is, how have states done this? How have they accomplished it? None of the policies on this list from cities and states were accomplished with the snap of a finger or the wave of a magic wand. Every one of them have a story that goes along with them. And consistently, those stories involve building coalitions, bringing people together from multiple large organizations, and foregrounding the voices of business owners, workers, healthcare providers, policymakers, local government leaders, and a broad cross-section of constituents statewide. And I think just to give us a quick glimpse of this, again, because the Colorado example is so recent, and I think also fairly typical, I'm going to see if I can attempt to share just one of the examples of the kinds of messages and voices that they featured for months leading up to the decision that voters were making on.
Our customers trust us. My business depends.
So cross our fingers that I'll get, I'll let you both see and hear this example here. It's very short. So. Okay, here we go.
Our customers trust us. My business depends on keeping reliable mechanics, so our benefits need to compete with the bigger shops. The guys have families, and sometimes they need time off, but paid family and medical leave is tough on my own. That's why I support Proposition 118. It helps businesses provide affordable paid leave. Small businesses like mine pay nothing, but employees are covered. 118 is just good business sense, especially now. Join me in voting yes on 118.
So that's one of just dozens and dozens and dozens of examples
22 years
of voices that in Colorado and in that other list of other states, folks brought forward in order to gain and win strong majority support for adopting these policies. So we want to wrap up by thinking about Iowa and where we're at and where we have the potential to go. We know that before the pandemic, and we know that after the pandemic, Iowa is a place where a very, very high proportion of households with children have both parents working. We've known that for many years. It's a big part of why childcare is also a critical issue in Iowa. And it makes paid leave a huge priority for Iowans. Iowans are caught between work and family responsibilities increasingly. It's also the case, and I think someone mentioned this in the chat already too, that a very high proportion of Iowans are responsible for elder care and caring for other family members. It's also true again and again in survey and polling and anecdotal experiences that I encounter with many, many workers. Men want to play a larger role in caring for children and also for their elder relatives, but are often blocked from those opportunities by unsupportive policies or lack of access to paid leave and job protection. And I want to share one more firsthand Iowa story from a local worker who is working as in a restaurant on the front lines. And this is, we know that restaurant workers are incredibly important and exposed during COVID, but these experiences are not limited to the pandemic context. She's saying, in my fast food work, we don't have the luxury of getting sick. my schedule varies and I don't have any paid sick days. If you call in, you need a doctor's note for the unpaid absence, but I don't have health insurance. And that means a doctor's note would cost over $100 for a visit. There's a bind that people are in that makes it impossible for them to be gone from work. I earn just over $11 after 7 years of work there, and I clean houses on the side. So I can't afford to miss work. And she also talks about family members. My father worked in a factory through a temporary agency. Many of his coworkers had been there for years as supposedly temporary workers without any benefits or sick days. Even when the pandemic began, they were required to show a doctor's note, even for unpaid leave. And that another trend in our state and really across the country is that more and more people are being placed in their employment by temporary or staffing agencies. And so they're much less likely to be able to access paid leave. And I know we had an excellent question in the chat related to those trends, even for social workers and other professions, where working on contract or working on a temporary basis is more and more common. So I want to say, what can we ask? This is a collective question that I certainly don't have all the answers to, but it's time for us to be asking these questions. What can we learn from 2020? What can we learn from other states? And what's next for Iowa? I think at a bare minimum, what we can say is we learned that the emergency experiment of offering and implementing a federal nationwide policy for paid leave worked for those businesses or workers who could access the limited benefits and who knew about the limited benefits. That we know that when it's implemented and people can access it, it can save jobs, it can save lives. And we also, in that federal law for the first time, prove that we can write a law that includes temporary workers and gig workers and folks working on contract. One thing we didn't talk a lot about today is that that law has a provision that offers tax credits, not just to businesses and small businesses and employers, but to independent contractors, people who work in that status could access the paid leave that way. And we also know that COVID is not the only virus or illness that affects people and affects workers. We needed some type of standardized paid leave policy before this crisis this year, and we will need it desperately, even more desperately afterwards. I'm going to turn it back over to Sue for her answers to some of these questions and some suggestions of where we go next.
Well, I wish I had all of the answers, but as we've seen, paid leave is a foundational public health and economic security issue that's more important now than ever. It's often framed as a social issue, but an inclusive federal, or barring that, state leave policy for a range of caregiving responsibilities is an economic issue too. Reopening the economy successfully means not asking people to choose between a paycheck and their health. Paid leave is essential, and it's so long past time that we adopt a robust paid leave program for all. So rather than go through a list of things you can do, I'm going to invite you to go to our webpage, and that's iowacan.org. And we have a sign-up form on there. And the added bonus is we have t-shirts, we have face masks, that if you sign up, we will, and commit to an action, we'll send those to you. And the actions include things like telling your stories. I mean, I think you heard today the stories that Charlie told and that Rashonda told and that I told and Jen told. Those are real people that are benefiting or hurting because of the COVID-19 pandemic and the paid leave policies that we have. You know, write a letter to the editor. Our elected officials, believe me, they scour the newspapers for mention of their names. And if we call them out on their policies, they'll start to think about it a little bit. You know, we need to call them. Probably this year, we won't be going much to the Capitol to visit with legislators, but they have phones and they have emails. And the same with our federal members of Congress. We just need to let them all know that we need paid leave for all. And I really appreciate and thank Charlie and Jen and Rashonda and all of our co-sponsors and everyone who's watching here. I'm sorry we didn't have time to get to questions. You can email me at sdinsdale@iowacan.org, and we'll try to get those answered. And again, if you go to our webpage and sign up, we'll get back with you as well. And that's iowacan.org. Thank you all so much for joining us.
Thank you, Sue.